7 local hospitals face constant change due to the pandemic. Now, they're hitting the pause button on certain procedures as they brace for a continued surge in coronavirus patients. The round-the-clock struggle hospitals face.
News 3 starts right now.
Thank you for joining us here at 7 o'clock. I'm Latoya Solman. Patients suffering serious complications from COVID-19, putting a strain on staff and resources in local hospitals. News 3's Max Darrow went to Sunrise Hospital to learn more about conditions there.
Here at Sunrise Hospital, they do have contingency plans for space. They say they do have enough ventilators if they need them as they come. But the big limiting resource, do they have the staffing? At Sunrise Hospital, the situation inside changes hour by hour.
We're a little higher on the ICU today. That's probably where we're seeing the greatest pressure.
That's Dr. Stephen Murder, the chief medical officer for the hospital. He took over about 2 weeks ago. His hospital, like many others in the valley, is feeling the pressure from the recent COVID-19 surge, and he says you have to prepare for worst-case scenarios.
We are looking at alternative sites to move patients.
The Nevada Hospital Association's latest report shows nearly 1,800 people are hospitalized with confirmed or suspected COVID-19 cases. The majority of them are in Clark County hospitals.
There's COVID patients all throughout the hospital.
Yarleny Roa-dugan is a nurse at one Southern Nevada hospital. She works in labor and delivery, but says there are days she's pulled to other departments, often to assist with COVID patients.
We have had to float to other departments to help out because the nurses, there are not enough nurses.
She says they've worked nonstop since March. Since then, some nurses have retired. Some nurses have gotten sick. But one thing in common, they're all exhausted.
We're using all our resources. We're working around the clock. The nurses are stressed out. That's the same level of stress as when we have a mass disaster.
Murda praised his team for the work they're doing, but adds they could use some extra help.
Nursing is at a shortage. We have added incentive bonuses.
Both pleading with everyone to take safety precautions seriously for the good of the community and the healthcare system.
It is serious. If I could walk you through my ICU and show you what my eyes have seen, I would tell you, this is no hoax. This is no conspiracy. This is the real deal, and our goal here is to keep us all safe in the community.
Hospitals throughout the valley are in need of nurses. Also, there are a handful of hospitals here in the Las Vegas Valley that are now either putting elective surgical procedures on pause or they're limiting surgical procedures to those that are for emergencies only. In Las Vegas, Max Darrow, News 3.
All right, thanks so much, Max.